And now we are joined by Governor Greg Abbott, who is speaking to us tonight from down in Austin. Governor Abbott, are you there? Can you hear me, sir?
I can hear you just fine. Thank you so much. Great to visit with your audience.
Thank you very much for giving us some time. Let's just dive right in. Let's talk about these travel restrictions. I know yesterday you enhanced some restrictions. Anyone coming from Louisiana now, driving or flying, has to do a 14-day self-quarantine. That also includes states like California. How confident are you DPS can actually enforce that 14-day self-quarantine?
Sure. First, let me explain to your audience the reason for this, and that is Texans are doing a good job of trying to contain the spread of COVID-19 in our state. In order to enhance that, we want to prevent people from importing COVID-19 from other COVID-19 hotspots across the United States. One of those hotspots where there's a greater rate of the coronavirus than in Texas is in the state of Louisiana. First, we put a self-quarantine for those who are flying in from New Orleans into Texas, but we know most people who come from Louisiana to Texas are coming through roadway. I have photographs I'm going to be posting on my Twitter account as soon as we finish this interview of the Texas Department of Public Safety working on the I-10 corridor along the border between Texas and Louisiana to make sure that they are enforcing that. They're doing the same thing on all the crossings from Louisiana into the state of Texas. So bottom line is Texas Department of Public Safety is at all these different import locations. Now, there are some exceptions for people who qualify under the exceptions that are established in the executive order. Other than that, though, they will be requiring everyone who travels from Louisiana to Texas to self-quarantine for 14 days.
Governor, we've heard a lot of concern from people in the medical profession about supplies. Are you confident right now that there are enough masks, enough testing kits, enough ventilators at hospitals throughout the state to handle this outbreak?
First, with the hospitals and hospital beds, we've done an inventory check of hospital beds, and then in addition to that, pursuant to executive orders that are issued, we've increased the number of hospital beds. Know this, as we speak today, of all the beds that are available in the state of Texas for patients who may have COVID-19, only 2% of that capacity is being used right now, which means there's a 98% vacancy rate. And we have even more hospital beds coming on board. And then on top of that, we opened up our first what I call ancillary facility in the Kay Bailey Hutchinson Convention Center in Dallas, Texas. We will be opening additional facilities like that across the entire state of Texas in the areas where there are the highest number of COVID-19 cases that do require hospitalization. However, know this, and that is, of all the people who were tested, only 10% test positive. Of those who test positive, only 10% need to go to a hospital. And so the number of people needing to go to a hospital is at a very low percentage.
Yeah, Governor, one final question here. I know we've seen a lot of local counties enact shelter-in-place orders. Under what circumstances would you do that on the state level?
The state requirement executive order that I issued already was based upon the CDC standards that were announced a while back. There's going to be an updating of those standards tomorrow. And as a result, I will be looking what the CDC and what the White House doctors prescribe. I talked to Dr. Birx earlier today to get a grasp on what to expect. And Texas will adjust its standards based upon what the CDC requires.
Governor, thank you. I appreciate the time.
Thank you.